Broadcasting on the move, travel and health for EVS operators and broadcast professionals. Today I'm joined by Damian Okruciński, a pediatrician and vaccinologist who was raised in Singapore, so he has international experience, but right now he's working in Warsaw, Poland. Thank you, Damian, for joining us. It's a privilege for me. We would like to talk today about the health and risks connected with travel, because we do know as outside broadcast professionals, we can be deployed with the next 72 hours in a different part of the globe. That's why it's super important not only to think about yourself, but also for others, because you can harm others, but let's say not taking a jab, not jabbing yourself. So today I'm with Damian in a CRIMED, the clinic here in Warsaw. And Damian, if you could just introduce yourself shortly, thank you.
So thank you for having me. It's actually a pleasure to be with you here, Piotr, and talking on this very important subject. It's not something that we approach lightly, because it is something that if in the work such as yourself, you have to suddenly, the next 2-3 days, have to go to a totally different country where you've never been before, where you have contact with bacteria and viruses, that diseases that you've never had before, the chances of you bringing it home and unfortunately also spreading it, not only getting yourself sick, but also spreading it to your family, that is a big problem. So it's a very important thing, and I'm very happy that we're talking about this thing. So yeah, myself, I actually grew up in Singapore. I am from Poland, but I spent around 14-15 years in Singapore, where I grew up, and then since my studies I've been in Warsaw, and I constantly travel. So ever since even as a student, I was traveling as much as possible for 2-3 months on end every year. As it is right now, of course, I can't travel as much as I want to, but I try as much as possible. So myself, it's normal for me to be 3, 4, 5 times a year to be in a different area of the world. So not only Asia, which I love, but also Africa, South America, etc. So yeah, so I do have a bit of hands-on approach to this kind of things. The other thing is I actually do work professionally with something called travel medicine, where we prepare patients who are going to these really sometimes dangerous places. And what we want to do is to make sure that they come back fully healthy as much as possible.
That's it. And our job, as you were introduced to the EVS and broadcast professional teams, our job is sometimes to just go and be deployed somewhere. And it is like really last time call. Sometimes they are calling us literally 48 hours before, and the producer can say, hey, you have to be in Africa, let's say the day after tomorrow. Or in my example, it was a year ago, I was in Dubai doing National Day, and I was asked while being in Dubai, can you go to, I think it was Ghana or Eritrea? I'm not looking up, but I'm not getting the exact location, but it was Africa. And I really wanted to go there because it was a really good job. It was a good pay. It was really nice. I have never been to Africa. I love Africa. I would love to go there. But apparently, I did some research, and as my wife is biotechnology, so she did research while I was working in Dubai, and apparently I could have been jabbed, but the time, that the period before, after being jabbed and to be fully immune takes some time.
Yes.
So I obviously dropped the job, even though I could really earn some good amount of money, but because I thought not only it's a good for me, my family, but if I come over to Africa and then come from Africa, not only I'm a risk for my family, I'm a risk for my friends. Obi-Wan in a TV studio. So I think that's the thing we are not considering even when we travel somewhere.
Yes. So what I'm thinking, what I'm think you're thinking about is yellow fever. So the yellow fever vaccine, it only gives you protection within 10 days. So that's how much you need to have receive the vaccine before you travel. The whole idea behind the vaccine is, of course, one thing, you don't get the disease, but also it stops you spreading it further. So yellow fever is spread by mosquitoes. So if you are going to go to an area which is endemic for yellow fever, for, let's just say Ghana, for instance, and you catch yellow fever and you don't have the symptoms yet, but you come back to, for instance, Dubai, or you go to India, or you go somewhere else in the world, and a mosquito bites you and takes the virus from you to, for instance, a monkey or somebody else. So somebody else can get sick, but if it goes to a monkey, that monkey can spread it further into other monkeys, and all of a sudden we have a very, very big problem with an endemic situation of yellow fever. So it is not just that we want you to be prepared. I don't want you to get sick. We also don't want the spread of yellow fever out of Africa. So as it is right now, yellow fever only appears in 2 continents. So we have it in South America and we have it in Africa. That is the only 2 continents where we have. But we are afraid that if yellow fever does go to other countries and other continents, for instance Asia, we will have a very big problem with the disease. Also, some countries in Africa require you to have the vaccination before you go to another country in Africa where yellow fever is endemic. So when you travel from that area back to where you are or where you're going to go, you can spread the virus. And in the first country, there is no more yellow fever. And the reason why they don't have it is because of vaccinations. So they got rid of yellow fever, and they're afraid that people who are traveling without the vaccine will bring the virus with them to their country. So it's always, it's not just us. We're not only thinking with our own let's just say egoistic mentality that I want to get safe for myself. We also have to think about the society at large, also when it comes to our family members.
So also it's not thinking about you or your family and your friends, it's also about thinking about the society back there.
Yes.
So you're not posing a risk
Yes.
for the local people. That's super important because we are a bit of hedonistic and egoistic, yeah, and we think only about ourselves. That's quite usual, but that's also the society which got rid of, let's say, yellow fever already, and we can pose a risk. Like they are not posing the risk, we are posing the risk, in short. So that's an original approach. I think nobody thinks about,
yes.
To my mind. But let's say, is it also a difference if you are coming to some, let's stick to a South American or African country? Obviously, we could talk about Europe, Asia, and Australia. It's not only these continents. Yes. But is it a difference if we go there, if we visit these countries in winter or summer, also if we are sticking to the city center like a capital, or we are going outside?
Yes, so it's a gigantic can of worms that you're opening here, because our winter can be their summer, especially in the south hemisphere, right? So when our winter is going to be cold and so on, at the same time in the south hemisphere is going to be very warm. So during the warm periods, we can also have more mosquitoes, which are going to bring more diseases, which are carried by the vector of the mosquito. So it is and also depends on the geography, depends on which country we're talking about, depends on which region. So it's not that easy of a question. In some areas, you have the situation that the capital city is safe from the disease. So, for instance, one of these best examples would be Ethiopia. So the capital city, Addis Ababa, is pretty high in the mountains. And in general, we say that in Addis Ababa, you do not have yellow fever and you do not have malaria. But if you go down from the capital city down to the outlands, for instance, then you are going to have more of the yellow fever. However, going to that country, you need to get vaccinated because they have yellow fever in the whole country, except for in general.
But they are checking that while you are on arrival?
Yes.
Or?
You have to have the vaccine to arrive in Addis Ababa. Well, so this is not just outside the airport. Once you leave the airport, they are going to require you to prove that you were vaccinated.
Wow, that's good, I would say.
And the other thing is, the next country you're going to travel to, they may require you to prove that you were vaccinated if you have been within 6 months of travel in an area where yellow fever has appeared. I have had a situation years ago when one of my patients went with his family for an all-inclusive trip to Maldives, and because he was a few months earlier in Brazil, where yellow fever is endemic, the Maldivians at the customs on the border they stopped him and they did not allow him to go into the Maldives because he was not vaccinated against yellow fever, and he was within the last few months in an endemic area, which was the Brazil.
Can you just define endemic word?
Endemic.
Phrase?
So endemic means that the virus or the disease happens there all the time.
Okay.
So it's endemic. So it's not like a situational that only appeared there because of one patient or because of one thing. Endemic means that it's the vector, for instance, the mosquito or the monkey, whatever, is carrying the virus with it all the time.
All the time. Okay, and if you would suggest, like I know it's as you said, can of worms are open, but we could talk about it for the next 2 days, I think. But if you would just give a few suggestions for like a broadcast professionals, for EVS operators, for vision mixers, for producers, for everybody from the production team, both technical and creative, doesn't matter. Any suggestions? What the checklist before going somewhere? I'm not talking about Africa. I'm thinking about Australia, Asia, United Kingdom, North America. Like a checklist, what we have to do before we depart.
Okay, so I think the best way is to go to actually a professional that actually works with this. So it's in Poland we have, and in some countries in the West, we have the situation where we have professionals that work with travel medicine. So they're specialists only to do, well, in general, to do with travel and the vaccinations, the diseases that are happening there. So it's always a good idea to go to one of these. The other option is that you can go online, and there are services, and I'm going to give you later on which websites I use, for instance, that we can see what disease happens in that country. One good one, for instance, is the CDC, so the American Center for Disease Control. Another one is the European alternative. Also, I'll give you a list later, and you can add to the podcast. And you can go to and see which country and what's happening right now. And the good thing is that they update it. So they update
It's live. It's not like from 10 years ago.
No. Unfortunately, some websites do have that, but most of the time it's updated.
Okay.
So they will tell you, right now we have a situation with this, or because of a big problem with this disease. So the CDC, so the Center for Disease Control, is going to tell you, in this area of Africa, you have currently a big problem with cholera, for instance, right? So,
but let's organize that
So,
before
yeah.
we'll give you the link. But let's say CDC website.
Yes,
Yeah.
CDC is going to be a very good one, and a British one which I really like is called Travel Health Pro. It's literally called Travel Health Pro, and it has very good, up-to-date information about what's going on. The ECDC, so the European Center for Disease Control, they also have a website with information, but Travel Health Pro has really good, and it's nice, it's well organized, I really like it. So that's a good one. And they will tell you which country, what you need to do. But in general, like the very, very basics of what you would have as a checklist. The first thing is yellow fever, like I was talking about. That only covers 2 continents, so South America and Africa, and not all the countries. But if you do go to areas where it is endemic, very highly recommend, you do require to have the vaccination to go. Another good vaccine to receive is the hepatitis A. So hepatitis A is a virus which is spread by food. It is easy to contaminate by, for instance, water, which means contaminated by, unfortunately, stool. And it's also the famous ice cubes. So I've heard many people say that, oh, we shouldn't drink drinks in Egypt or something because of the ice cubes, right? That avoid ice cubes. So here's the thing: hepatitis A survives freezing. So what can actually happen is you can have, and this has happened before, strawberries frozen a year ago in a different country, eaten in Australia, and all of a sudden you have an epidemic of
It looks like there's no way out sometimes. You have to be vaccinated.
Exactly. Or you cook the food, right?
Okay.
And nobody unfreezes strawberries to cook them, right?
Obviously.
So everybody eats them
Yeah.
straight away. So that's actually what happened a few years ago in Australia. So that's unfortunately problematic. So hepatitis A, the 2 doses cover you for your whole life. 1 dose today, the second dose in 6 months, at least 6 months, it can be a year or 2, and the second dose protects you forever. With yellow fever, which I was talking about, one dose for your whole life. That's all
Okay,
you need.
that's
So just
easy.
one dose, and that's it.
No excuse
No
then.
excuse.
No
It's,
excuse.
it's easy to receive it. It's not an expensive vaccine. It's well tolerated. Of
You
course,
know
your
what?
arm
I
can
got
hurt.
this yellow fever after rejecting the African
Yeah,
job. So
exactly.
I told to my family that they will never forbid me to go to Africa.
Yeah.
So thanks to you,
You're
I'm
welcome.
jabbed fully right now. So
Yeah,
yeah.
so exactly. But see, it's easy. Once you receive the dose, you're done. That's all you have to do. If somebody received the yellow fever vaccine years ago, they may require to have it updated in the documents, and that is all they need to do. But that one dose protects them forever. Okay. The other thing that we really recommend when it comes to these kind of travels depends on which area you go to. But of course, diphtheria, pertussis, tetanus. So these three things is in one dose. The main reason I'm going
Is
to
there
talk
a human translation?
so diphtheria is what's going on right now. So diphtheria in Polish it's called błonnica.
Okay.
So diphtheria is a very severe disease which we haven't seen in Europe. Well, we haven't seen in Poland in the last decades. But unfortunately, we have 3 cases of diphtheria right now because of one patient who came back from Africa. A child was unvaccinated, and because of that, other people have gone sick. So this is when we're talking about protecting not only yourself but also others. So in this case, the diphtheria vaccine, the child didn't receive it at all. They got it in Africa, and they took 2 flights. Because of that, 2 people we know of have caught diphtheria, and the other thing is 500 people are from contact, and these 500 people we have to find them. You know if they were vaccinated, whether they've had
That's
the
the
disease,
latest
and so on.
case, which was on the
Yes.
news, right? Okay.
Yeah, this is the last week.
Okay,
So
yeah.
it's currently going on, right? So this one patient who got the disease can spread it up to 500 people, and somebody, so our government or the health services, have to find 500 people and tell them, were you vaccinated? If you have symptoms, you have to go to the doctor. You don't go to the doctor, you have to go to hospital because diphtheria is so bad, right? So yeah, so as I was saying, there's the vaccine which contains all 3 of these: diphtheria, pertussis, and tetanus. Pertussis is whooping cough. So it's really bad. It's called the 100-day cough. So I've had pertussis before. It's if you're vaccinated, it's literally you just cough for 2-3 months. It takes time for it to stop.
Still.
But yes. But if you're unvaccinated, pertussis is a very severe disease. And I've had a patient that, because of pertussis, not only did her ribs break, but she also was bleeding into her brain. It was that bad. So that's how bad the attacks of cough are. Now, tetanus is a disease I've only seen once in my life. Tetanus, you can get it from a small wound, for instance, in your hand or your foot that gets contaminated with soil or rusty nail, as it's, people talk about. And what happens is you develop these extremely painful muscle spasms. When I was working in Borneo, and I worked for a few months in Borneo in a very remote area, we had a patient of, I think he was 8 or 9 years old. He died because of tetanus. We didn't have enough, we didn't have the proper treatment for him, but he had shocks of pain because his muscles were compressing, and I could actually see on his arm where fibers were actually snapping in his arm. It was extremely painful. So yeah, that was not nice. So yeah, and this one vaccine for all 3 of these diseases protects you for 10 years. Easy jab, you got it. I remember when you got it, and you're done. So yeah, and your children were also vaccinated. So yeah, it's easy.
Yeah, it's totally worth the cost. Like it's the life is worth the cost. So, and the biggest mistakes, if you could just simplify the biggest mistakes of people traveling, because you don't have to focus on the broadcast industry, as these are not your main clients always, but like the biggest mistakes, like if you can recall anything, like what the people are doing bad before?
So one of the biggest mistakes I've noticed is that people say, oh, my friend Michael, he went and he came back and nothing happened. Yeah, Michael was lucky. He was in a hotel for a week and he was eating steaks made by a really good chef and whatever, and he didn't have any problems, yeah? But you eat once on the street, or you drink water that wasn't prepared properly, and you stay in the bathroom for the next week, for instance. Instead of working, you're staying in the toilet. Fun. Or yeah, yeah. Or you come back and your skin goes yellow and you feel like like your life is ending, and because you got hepatitis A. So that's the problem. So just because people say that we know somebody who went somewhere and came back and nothing happened, does not mean that you're going to have the same situation. So that's one thing. Other thing is forums on social media. Quite often you're going to have three people say, oh yeah, malaria isn't the problem, I had malaria and nothing happened. And then you have a professional at the back saying, beware of malaria, it kills people. And everybody's saying, oh, all these other people saying, don't worry about malaria, it's not a big of a problem, right? So don't always believe what people say on the forums. In terms of when people do go to get vaccinated, one problem that I've quite often had is that people come too late for the vaccination. So after vaccinations, you need around a week and a half, two, for you to develop the antibodies. So the protection only develops within some time. If you do the vaccine today and you fly out tomorrow, you're going to start developing your protection while you're there. It's better than nothing, but still, I prefer if you came a week or two or a month earlier. Just be prepared for the trip and so on. Or if you have, if in your industry, if you have the off time, so if you have a month that you know you're not going to be traveling, just go in that time. So yeah, it's a good idea to do that. Not just because you have to travel somewhere, but because you may have to potentially travel somewhere in the future.
And just saying that somebody came from someplace and didn't get a disease is like saying that I just crossed the street on a red light and nothing happened. Yeah, you were lucky.
Yeah, that's a very good comparison.
Can you tell me if the people are being jabbed, or was the trend like?
So the trend is actually increasing. I've noticed that there is more people. First of all, I see that a lot of people are traveling. It's more cosmopolitan. It's more common for people to travel to really weird places. I had a few years ago an 18-year-old who was leaving the first time he's going to be leaving Europe. And he was going to go to Ghana. Why? Because he wanted to see the voodoo, right? So yeah, okay. So it's not, people don't just go to Egypt now. People go all around the world. And in terms of people in your industry, they're going to go to really so-called weird places for us, right? So because they're good professionals, and in that country, all of a sudden they have money, they want good professionals to come and work with them and so on, right? So I think it's a good idea to prepare for these kind of things. And I think the trend right now is that more and more people are being vaccinated against these things because there is more information out there. It's easily available. And people who do use AI, the AI is going to tell you that one of the things you should do is get vaccinated for these kind of diseases. Of course, it's a good idea to take medicines with you. You have to be prepared for what can happen in the area you're going to go to. But vaccinations,
it's also cool what you said, because a lot of people are just using a famous ChatGPT right now, even though that's not the only one. But it helps also. Yes? It can be helpful.
It does help you a lot. So I've actually, before our talk, I actually did this, and I wrote into ChatGPT, I am going to be traveling to these kind of countries. What should I do to prepare? So try it, see what it helps you, and say that what you have to do, prepare for the health benefits and in terms of what can happen to your health in that country. It will tell you one of the things you should do is see a doctor to talk about your diseases, if you're being treated for something, if you need more of the drugs that you're receiving, you need more of fill up, but also if you need drugs to use while you're there, for instance. Okay. So we can give you drugs that help you if you have diarrhea. We can give you drugs that help you if you have vomiting, and so on and so forth, right? So it's easy to take care of that. And of course, the most important thing is for malaria, right? So the best way to protect against malaria is either not get bitten by mosquitoes or use the medicine that we use that kills the parasite of malaria.
So basically, ChatGPT can focus you on some points, and you are at least more aware of where to go, what's going on. Then you can go to the vaccinologist and just ask further your questions. Yes. So that's really cool way of just using this artificial intelligence, which is right now often in our life. But it's you want to say something?
Yeah, and I think actually what you could even do is ask ChatGPT, what vaccinations do I need to travel to this country? And then just go to your general practitioner. You can go to your family doctor and say, the AI told me I should receive these vaccinations. What do you think? Do you have these vaccines? When should I receive it? So I believe a family doctor is, or a GP or whatever, is more than ready to help you with these things. And by the way, if he doesn't know, he can use ChatGPT as well, right? So
Yes, obviously everybody is using that, but it's not only about Africa and South America.
Yes.
Yeah, I think even if you're going to the UK from Europe, there are some. We will show the map of the potential risks you have here in your room. But there's something like we also have to think about United Kingdom or United States of America or not. Like at least let's say I'm European. Let's
Yes.
just focus on I'm European. So obviously it's not only South America or Africa. It can be Australia, Asia, even the United States, Canada,
Yes,
yeah,
yes.
and United Kingdom, yeah.
Yeah. So in terms of like, if you're going around the same areas for us, for instance, if you're European and we go to the UK, in general we have all the protection that we need because we live in the same situation. But for instance, if you're going to go to the United States, for instance, the United States is a gigantic country, right? So we have, for instance, in the south, we have Florida, right? This is literally the tropics. Right, and you have dengue fever there, right? So dengue fever is a virus that's carried by by the mosquitoes, and you can catch dengue fever in Florida or other areas such as that. So it's not just that we don't think about countries. We think about the geography, which geography area we're going to go to. So that's what we're more thinking about. So if we're going to the tropics, or you're going to areas which have for instance, the mountains as well, right? Because we always have to remember about altitude sickness. So myself, I got altitude sickness in Bogota. So in Colombia, nobody thinks about altitude sickness when you go to a capital city, but but it was high enough that we got altitude sickness. So yeah.
So
And we can prevent altitude sickness as
and
well.
we think about the geography of the countries. That's a good point. So let's summarize. So if we can ask ChatGPT to help us out finding out what's going on, where. Then we go to our vaccinologist, yeah, and ask him or her about the further needs to be done, further things to be done, and these organizations were one more time CDC. Can you repeat them?
CDC or Travel Health Pro, which are the ones that I use myself the most commonly. Yeah.
And hopefully, guys, this was something that really helped you, and hopefully you are right now a bit more aware of what's going on, what you have to do before traveling. It's always not about the money. It's firstly health and the money, because if you're not healthy, think about that way, you will not get money. So it's quite easy. I'm just trying you to read me, yeah?
The last time I didn't receive the vaccine for influenza was when I got sick with influenza and I didn't get the vaccine, and I spent 8 or 9 days without work. So I was a young doctor, right? And 8 or 9 days without work, then that was a pain in the pocket, right? The next year I decided I'm going to get the vaccine because I remember how badly I went through influenza without the vaccination, right? So it just makes pure financial sense, not just health sense. But
so
yes.
in short, no vaccination, no money. Some countries also are requiring you to be vaccinated, yeah?
Exactly.
And don't throw the jobs out to the rubbish bin after you just buy them. Don't do that. Don't do that. People do that. I know. They're just buying just to be legal and then just get it out. But yeah, let's not think about these cases. So yeah, I would like to to thank you one more time for helping us, right? And hopefully, and I know that's the first one of the series to raise awareness about the vaccination and all health, because we're thinking about. We are having a fast life. We don't think about ourselves on health. We think about goods we can buy after getting good money, and then we think when it's too late. So let's try to raise the awareness together. And thank you one more time for your time. I know that you have patience in 1 hour, so we have to clean the room right now. So we'll be leaving right now with our crew. So guys, hopefully you got something from the interview. Is the first one of our series, go check, do your checklist, check what you have to do before traveling, before even you say, hey, okay, I'm going to the producer. Firstly, do not harm yourself. Secondly, do not hurt anybody around, not only your family and friends, but also local society, because you can bring something
Yes.
to the local environment. So thank you one more time. That is all for today, and hopefully you enjoyed.